Kathy, thanks so much for sitting down with me. Since my readers probably don't know a lot about you, would you mind just starting with telling us a little bit about yourself?
Well, I'm a veteran. I'm a retired Army nurse. I served active duty 20 years and 3 years reserve. My last job in the Army was I was a staff officer to the United States Army Surgeon General, right? And I advised him on quality healthcare matters and customer service. And then the big thing was evidence-based guidelines, VA, DoD, clinical practice guideline project officer that was to improve the quality of healthcare for soldiers, sailors, airmen, and Marines, and veterans. So I was the lead officer for that for the Department of Defense. And then I was an educator, started the UD nursing program from scratch, started the graduate program at Mount Mercy, and then was dean at Kirkwood for 10 years. And when I first got out of the Army, I taught at the University of Iowa, where
Mhm.
I have a bachelor's and master's from. But I think I'm a doer. Not a politician. I'm a doer. I make things happen. So start things and get them implemented, and they're all still going strong. UD, the Practice Guideline Project. And then I've been a public servant. I've served on the Iowa Board of Nursing. I'm on the Dubuque County Board of Health. I've served on the Finley Hospital Board of Directors, and I'm on the Hospice Board of Directors, Dubuque Hospice Board of Directors. And I always like to tell people my first jobs, I was a CNA, because
Mhm.
I think you just fully jumped out like this PhD, Lieutenant Colonel Army nurse, right? I started out as a nursing assistant. I worked in the dish room at the University of Iowa. I worked at Kentucky Fried Chicken,
Mhm.
and I was a shipping clerk in a national lock factory, and a
Mhm.
ski waitress. So
Oh,
I'm a hard worker. So I started, we just like everybody else, we start out, we don't know anything, and then learned
mhm.
a lot and moved forward.
And where are you living now?
I live in Asbury, so when I retired from the Army in 2002, I moved back home to Dubuque. I
Mhm.
graduated from I attended Holy Trinity Grade School in Dubuque
Mhm.
and graduated from Wallard High School in Dubuque, went to
Mhm.
Loras College for 2 years there, and then had transferred to University of Iowa for nursing.
Mhm.
And so I retired to Asbury, so I've lived in that house, have a house where the family congregates. Uh, that I'm single,
Mhm.
and nieces, nephews, one of seven kids, and everybody comes to my house for July 4th and Thanksgiving and Christmas. So I'm a cookie baker.
And
So
so were you up in Dubuque County the whole time you were at Kirkwood then?
yes, and I drove back and forth. So a 3 hour commute every day back and forth. So yeah, so about 20
That's a
years.
long commute.
Yeah, well,
Wow.
I listen to a lot of news and
Uh-huh.
I sing a lot of songs. So, yeah, listen to a lot of, start singing along, right? After the news is too much, then I turn on the tunes.
Right. And when did you start thinking about running for Congress?
So I've been working, between working 60 hours a week, being a dean, 50 to 60, and driving 12 to 15 hours a week. What I did is, I listen to news and you're upset and I'm yelling at the radio and I'm driving along. But then since I've been only part-time, I'm part-time right now, not full. I was getting more and more worried about what's going on.
Mhm.
And then I said, well, when I've always been a patient advocate and a student advocate, and so it was time to you know, if Marjorie Taylor Greene can be in Congress, why not a PhD lieutenant colonel who knows research, knows evidence, and knows how to make evidence-based, data-based decisions?
Mhm.
So then then I started exploring, and I sent messages, talked to people, and they referred me to different, like Fred Hubble and Christy Vilsack and Rita
Mhm.
and the Dubuque, the county chair people, Democratic Party chair people. And then went to like 4 or 5 counties, Poweshiek and Hardin and Delaware. And so then I just decided, well, hey, if you see something, you got to do something, right?
Mhm.
Because democracy dies if we
Mhm.
just sit around and watch it. So that's why.
And are you planning to be full-time campaigning or are you still going to be working part-time?
No, I'm going to be full-time campaigning as of the end of in August, starting August 1st, because my
Mhm.
position here will be completed by
At at
at
Mount Mercy.
yeah,
And
at
that
Mount Mercy.
and what is the position exactly?
Right now, I've just been again helping out. My position is like I was originally hired as a BSN transfer advisor. I love students, so I was retired from Kirkwood, but I didn't want to be away from students. And really, I'm not a person who's going to retire, right?
Mhm.
And so then somebody else left. I became the clinical coordinator, which is I hire all the clinical faculty. And I know a lot of nurses around Eastern Iowa because I've been here. And then I even taught full time when someone on maternity leave.
Mhm.
And so, yeah, so now I'm back down to only two jobs, but those at the end of this month. So then full time.
What would you say are some things about nursing or nurses that you feel that people don't understand or appreciate more?
Well, I think nurses save people's lives. Doctors are incredible people, but they're very, very busy. And sometimes they're not right there with the patient all the time. And when you see something, a change, you have to say, this plan that the doctor put together, a well thought out plan, maybe doesn't apply right now with these patient changes. So your job is to go to the doc and say, hey, this is what's going on. I think I would suggest this, and then the doctor makes the decision to implement the change in care. And if they don't listen, like when I was in the military, and at University of Iowa, you keep on going up and up until finally somebody listens to you and you
Hmm.
get the change you need because nurses save people's lives. They are
Hmm.
the coordinators of care and they're on the ground and then can help the doc develop the best plan because of our assessment skills and our critical thinking can help the doc put the best plan together to save the patient's life and to help them to better health.
What do you think are the top things that Congress could do that would make things better for nurses or for the healthcare system
Our
generally?
healthcare system, they've got to stop cutting. Medicaid cuts are going to hurt Iowans and all Americans. They're going to hurt. I think the biggest thing is the rural hospital impact is going to be huge, and there's a $50 billion bailout for rural hospitals, but that's a drop in the bucket.
Hmm.
So that the Medicaid is a third. And when I was at Finley, and this was back when I was on the board of directors of a hospital back in the 2000s, that was Medicare and Medicaid made up half of the income of the hospital. So if you cut 25% to 33% of a hospital's budget, even in a community hospital in a city,
Hmm.
that is going to lead to that hospital being hurt. And the majority of rural hospital is probably Medicaid. And so
Hmm.
then the rural hospitals will close. The hospitals in the city, what will happen is they're going to have lots of uncompensated care. People who
Hmm.
seek care in their emergency rooms, overburdening is a high cost area, and then going to have uncompensated care. And then the rest of us, our insurance is going to go up because they're going to have to pay for that uncompensated care somehow.
Hmm.
So that's it's going to be a big rural hospital impact. All hospitals impacted. Nursing
Hmm.
homes, Medicaid pays for nursing home care, so
Hmm.
that's going to hurt. Um, Rural health care for women's health is really going to be hurt. Um, we have the worst women's maternal mortality rate of any developed country, right?
Hmm.
And it's worse in rural women, right? Their mortality is higher than other women in this country. And we've got the worst maternal mortality than any other developed country.
Hmm.
So that's going to be impacted. And then children, 80,000 children in Iowa who are on Medicaid are going to be impacted
Hmm.
whether either because their parents lose it or It's just you cut Medicaid and it's cut. They got to cut a lot. I don't even know
Mhm.
where they're going to cut it, and it's going to hurt. I think that's the big thing. And then the other big health thing is the immunization changes
Mm,
by that Robert Robert F. Kennedy Jr., right?
mhm,
Person who is an anti-vaxxer, who's the lead for our health and human services in the United States. And immunizations are the number two most life-saving medical innovation in history, second only to water treatment and sewage treatment. And
mhm,
so this is going to really hurt. It's hurting. It's going to cause people to die. It's causing people to die. And then, obviously, the cuts to the immunization programs all over the world are disastrous. Because if we travel and people travel to us, those
mhm,
diseases are going to impact us. So those
mhm,
health is just huge. I mean, if you don't have health, you don't have anything.
mhm. What are some other issues that you plan to emphasize as part of your campaign?
So probably in the health area too is the cuts to the SNAP program because there's child and family hunger. If you're not eating right, if you don't have access to good food, that impacts your ability to participate in school, to participate in work. Um, I think the cuts to the cancer research and all the research programs, university research programs, especially in healthcare, like at the University of Iowa, are going to hurt us. We're the number two. Iowa has the is second leading increased incidence of cancer in the country. And here we're cutting research, health research. Um,
And
and then
mRNA vaccines.
yeah, mRNA vaccines got that cuts to the COVID vaccine program. And then they've stopped the development of the bird flu vaccine, which is potentially the next big
Mhm,
pandemic. So I
mhm,
think that those things are really huge. I mean, it's like you can't think of, all these disasters. And then obviously we're going to have increased other impacts of health is when you cut FEMA and NOAA, more people are going to get hurt or have decreased ability to recover from disasters. So first of all, you want to prevent the disasters with NOAA, but if we don't hear about the tornado or the flood, right, we're all going to are you can't put people back together. I was a neurotrauma nurse, a critical care nurse, and oh yeah, well, we can save people's lives. Yeah, we can save them, but if you went through the windshield and you've got a head injury or a spinal cord injury, we can't put you back together. And so I just say that the biggest thing we need to do is stop the bleeding, stop these cuts, and then you got to figure that stop the bleeding, build back to baseline, and then figure out what you really need to do. We have the worst healthcare system of all developed countries. We pay more, 2 to 3 times more per person than any other country in uh,
mhm,
developed country, right? So we have the shortest length of lifespan for men, the shortest length of lifespan for women, the highest infant mortality rate, the highest maternal mortality rate, and then we live in the green zone the shortest amount of time. In the green
mhm,
zone is when we're not on meds and we're healthy till we're about 45 or 50. We're in America because our lack of focus on prevention, we're in the yellow zone where we
mhm,
live with chronic illnesses, right?
mhm,
That a lot of our behaviors cause. And we're on meds and not feeling good and overweight and diabetes and hypertension and heart attacks. And then we die younger. So we live the shortest time in the green zone, longest time in the yellow zone. And then we deny death and we're in and out of the hospital, spending money the last year of our life
mhm,
trying to prolong it.
mhm,
Right. So when maybe we need to focus on green zone stuff. So
mhm.
that's just healthcare is just pretty broken in this country.
Yeah, that's for sure. I want to ask you about something that I think is a big fault line among Democrats this year, and it relates to the federal budget and how to relate to the Trump administration. And in March, there was that big funding bill to keep the government funded through the end of the current fiscal year, so through the end of September. And most Democrats in the House and Senate voted against that bill. Then a smaller number in the Senate voted with Republicans just to avoid a federal government shutdown. They went ahead and voted for that federal government funding bill. So I'm wondering how you viewed that situation. You said you follow the news pretty closely, and how would you approach that as a potential member of Congress? I mean, would you be willing to go to the mat and possibly even have the federal government partially shut down or do you feel that it's more important to keep the federal government funded at all costs?
Well, what federal government? Because it's being
Mm,
cut. I think they should have taken a stand. I think they should have voted to shut it down and had it shut down and then maybe get people to focus on what's happening here.
mhm,
And to me, it would have been, um, I think they just need to get attention to it. I feel that is one thing is that the national Democratic leadership seem to be lost and they don't have a message and they're not fighting hard enough. I believe President Obama came out and former President Obama said that a couple last week or the week before too. It's like, there's nothing left to say, right? They're cutting it. And I
mhm,
used to be I worked for the VA in Washington, D.C. at the VA Central Office for Healthcare Quality Management Office, and on the VA side of the VA DoD Guideline Project. And I went to work every day trying to do the best job I could, right? And a lot of former veterans work in the federal workforce.
mhm,
And I think we're going to not have anybody to talk to. Services are being cut. There's not going to be anybody there to answer the phone pretty soon. So service to the American people and to Iowans is going to go way down. I mean, you can't. So like, I don't know. We should have just stopped it.
mhm. What I want to ask a little bit about your campaign. Have you been out? You said you have been to a few counties
Yeah.
talking to voters.
hmm
How's that going? What's the mood? What are you hearing from voters out there?
The number one issue that I keep on hearing is the contempt for the Constitution, right? The erosion of our freedom, and the erosion and the worry about, um, and I think the other thing is the fear that's out there what's happening right now is they're being very, very cruel to immigrants, cruel to federal workers, cruel to veterans, and they're like it's the politics of fear, and that is, I think, um, if what I think people forget that if they can do it to an immigrant, what's going to stop them from doing it to you next, or whatever the next group of people is.
Mhm,
And so we've got to stop being cruel to others, and we need to be stop being cruel to each other. Like I was so amazed that the front just announced, and the head of the chairman of the Iowa Republican Party calls me a left-wing radical political activist. I was like, well, I don't know. I'm a Iowa nurse, veteran, educator who bakes cookies, and has really. I was an independent until 4 months ago. I pretty much voted Democratic, but I
mhm,
also wanted the freedom to always pick the best person for the
mhm,
job. And I'm
mhm,
always so amazed that at some of the people who do run for office. I was like, well, what have they done in their life that makes them qualified? I always think it's so
mhm,
funny that, like I would want any job, I want to see their CV. I've hired people. I want to see your CV. I want to see what you've done with your life. I want to see, you know, check your references. But the big thing is if you've never ever done anything in your life, why am I going to hire you to represent me?
mhm,
So I think I have a very good CV, curriculum, vitae,
mhm,
resume.
mhm,
I've done a lot of things. I'm a doer, I'm a producer.
mhm,
I start things from scratch. I started a neurotrauma ICU from scratch. I started the VA DoD guideline project from scratch, and it's still going today
Hmm.
until they find it and destroy it out there. And because it's been going for 26 years, I started two different nursing programs. I
Hmm.
start things and I can finish them through accreditation and they're still going strong.
Hmm.
So I think people, I think Iowans and Americans have to do a better job of like, what about this? What's this person's qualifications? And then are they ethical and moral?
Hmm.
Right? Ethics and morality are a big thing. Um, and are they kind? It's like, I just hate all this throwing everybody into the bus all the time. It's like,
Hmm.
stop it. And it's like, what's the issue? Tell me what your issues are. I can stack my CV. I looked up the chairman of the Republican Party. Seems very well qualified. MBA, PhD, farmer who teaches at the local community college, right? But go right to name calling, it kind of makes him a less credible person, I think. So I think we lose credibility when we call people names and like go
Well,
knock yourself out. Call me whatever name you want to, but the only person you're making look bad is you, right?
he's called me names as well.
There
It's
you go.
the
No, yeah,
trade.
I mean it's
It's
like
the
good.
Trumpification of our politics,
I
I
know,
think.
but that's what I'm saying is yeah, we just can't fall for it. If they want to
Mm-hmm.
do that, I
Hmm.
mean, we can attack all the policies that are wrong, right? That's what I'm going to try to do is attack policies, not people. Because in quality improvement, right? It's
Hmm.
not the person that made it's the system and the processes that cause mistakes to happen and errors in healthcare. And very rarely is there a real bad actor, though we
Hmm.
might agree on maybe the big bad actor, but
Hmm.
we won't go there.
I want to get your take on Dubuque since obviously it's an area you're really familiar with, and it's kind of the archetype of this Mississippi River county that was a longtime Democratic stronghold and has now become more of a Republican leaning area almost, at least at the county level. And what are your thoughts on why that's happened and how Democrats can turn that around?
I don't know if it was very Catholic. Obviously, it's a very Catholic. I'm a product of like myself. I'm a product of 14 years of Catholic school, right? And it might have been an overemphasis on the abortion issue, right? From in this Catholic enclave, right? And while I myself am pro-life, I fully support a woman's right to choose, right? Because I can't walk in another woman's shoes.
Hmm.
I believe the one thing, though, is that Republicans who wag their finger and people who wag their finger at women who have abortions, right, and say
Hmm.
you can't have that abortion, that if they really believe that abortion is bad, they should help women we had a thing for our guideline project, make the best way the easiest way. So you make it as easy as possible for a woman who's economically challenged and might be making that decision based on economics, make sure that the child will have childcare, right?
Hmm.
Childcare is so expensive and is not even existent sometimes. We need to subsidize and pay for childcare. We need to pay for health care for children up to 18 through Medicaid for everyone, not just,
Hmm.
for everyone. And then for women's health, women's prenatal care, not just prenatal care, the woman has to be pregnant, healthy before she ever gets pregnant. So
Hmm.
that's ridiculous. And if Republicans want all women to have babies all the time, well, then you better be paying for child care, health care for the children, and pay for all women of childbearing age health care, right? And
Hmm.
then maybe women would make a different choice, whatever that
Hmm.
choice is for them. But you make it easier for them to have the baby than to not have the baby, right?
Hmm.
So I don't know. I just think maybe it would have been I think it was an overemphasis. I
Hmm.
think that we need to emphasize all the other that they're hurting the lives of people who are actually alive right now. So, or hurting poor children. What is it? 40% of all children in Iowa are on Medicaid.
Hmm.
Like we've got lots of things to take care of, right?
Hmm.
And um
Hmm.
and so I think an overemphasis on that
Hmm.
issue and maybe not, I think Nancy Pelosi calls them kitchen table issues. We need
Hmm.
to focus on the cost of living. We need a living wage. It's insane that the minimum wage is 7.50. It's
Hmm.
like nobody, and finally nurses' aid wages are going up to about 20 an hour.
Hmm.
But people need to have a living wage. The majority of people on Medicaid already work, and they're in low-paying jobs where no employer health insurance is available. And the biggest employers are Walmart, Walmart employees on Medicaid, Amazon employees on Medicaid. Well,
Hmm.
why are our products so low priced? Well, because we're paying for their health care through
Hmm.
Medicaid instead of them paying for the health care. And if we truly want an employer-based healthcare system, then all employers should be required to do that. I would say that it's not a smart system because then it makes our employers non-competitive with the rest of the world, right?
Hmm.
So I think those tariffs are a big issue,
Hmm.
right? The tariffs that are out there that are going to increase the cost of living for all Americans.
Hmm. Thinking more broadly about the district, I mean, Northeast Iowa is an area that for much of our lifetimes was Democratic leaning. Now, the district as a whole voted for Trump by about a 10-point margin. How would you approach trying to win in a district like that that is no longer Democratic leaning?
I think it would have to be through some of the interest groups, like the veterans that are up there, the farmers specifically speaking to their needs, the nurses that live up there, the educators. I think the big thing that people are probably worried about is the Main Street, that their towns are dying, their main streets have died. How do we revitalize these communities? Well, the only first you've got to make sure that the local hospital stays open, that the local school stays open, and these and Department of Education cuts that are going to hurt your schools.
Hmm.
Stop those. Stop the Medicaid cuts to your local hospital, and then look at policies that help revitalize. And I don't know the answers, right? There are experts out there, so to me, if I would always go to who the experts are in that area, get them together and hear what they had to say for what are the options and make a recommendation because nobody can be an expert. When I did VA/DoD guidelines on obesity or diabetes, I didn't write the guideline. I brought all the experts from across the Army, Navy, Air Force, and VA healthcare
Hmm.
system together. They looked at the evidence and they wrote the guideline. And
Hmm.
then I was the developer with others, Rand Corporation and others, to develop the process to develop the guideline and then get a process for implementation and then measurement. So I think that's another thing is we need metrics. I mean, it's like every company, organization has metrics. What's our mission for any government program? What's the mission of the program? How will we know if we were successful? How many people served? How much money did it cost per person in the program? Were we successful, right? So
Hmm.
that anybody should be on their front page of any government program. So then you can judge because they're always shouting fraud, waste, and abuse. Well, I don't think
Hmm.
there's fraud, waste, and abuse, right?
Hmm.
I believe they haven't found any. I think
Hmm.
they just are on message. Fraud, waste, and
Hmm.
abuse, fraud, waste, and
Hmm.
abuse. And I think we have to have a counter message, which is cruelty, corruption, and contempt for the
Hmm.
Constitution or something. It's like
Hmm.
we all need to be on message. It's like
Hmm.
they're a machine and they
Hmm.
all toe the line and we just don't.
Right now, you're the only declared Democratic candidate in this race, but Lindsey James has said that she's considering it. There may be other candidates who join later. What
I
would
think
be your pitch to Democratic voters who say, "Hey, I like both of these candidates, or I like all of these candidates. Why should they support you in the primary?"
Oh, I think, and I met Lindsay James, and I think there's someone from Cedar Rapids who's going to announce tomorrow, and
Mhm.
I believe he's a wonderful candidate. What I bring is lots of experience, lots of common sense, and I've lived healthcare. I know healthcare. I think that's one of the top issues. I've run population health prevention and chronic disease management programs. I'm an educator, so I know the issues related to education. I've worked with immigrant students. I've worked with poor students who are working so hard to get through college and put learner success programs together for them. So I've got real world experience as a veteran, a nurse, and an educator. And and I'm also single, which gives me lots of free time to just work for my constituents. And again, I think that Lindsay's a fantastic, she'll be a fantastic candidate, but I just think I bring a lot of experience. And again, when you look at the CV,
Mhm.
if you were hiring somebody, the people who are doing the hiring are the constituents, and they have to look at what any of us have done and pick the one who they think uh, I've been in DC. I've been, um, but I've been at higher levels,
Mhm.
at strategic level in the Army and Department of Defense.
Mhm. Is there anything I didn't ask that you think would be important for my readers to know about you or your campaign?
No, I think you asked some really, really good questions. Yeah, I just want to say that I would always advocate for the health, the safety, the education, and the economic welfare for Iowans and Americans. And I took an oath to the Constitution. I would protect the Constitution of the States against all enemies, foreign and domestic. And I believe in the Constitution, and I believe that Congress right now is not doing its part to live up to what it says its roles and duties are in the Constitution. And so I think that that's very, very worrisome, and I would work to change that. And I don't mind advocating and going up
Mhm.
against the big guys. So
Mhm.
I've done it all my life. So
Well, thanks so much again for taking the time, Kathy.
yeah, thank you so very much for the opportunity.